Hi folks, Mark here. I thought I'd make a video about my mental health situation. So it's going to be a mental health blog. I don't know if anyone's going to watch this, but if anybody is watching and they're going through the same thing as me, maybe I might say something that might help you or encourage you. I've suffered with anxiety, very severe anxiety, for a great part of my life, and I've had counselling throughout various times to try and stop the anxiety. I went to my GP about 5 weeks ago to discuss maybe some counselling. I felt really good and I felt fine, but I've still got anxiety sort of in the background, and it needs seeing to. My GP decided that because I've had anxiety throughout my life, he decided to do a slightly more in-depth psychological analysis, and I spent an entire hour with my GP. Those of you who live in Britain, who go to see your GP, will know that spending an hour with your doctor is incredibly rare. They like to get you in and out quite quickly. So I spent an hour with my GP answering lots of questions, and he decided there and then to phone the local psychiatric hospital. It's the Prospect Park Psychiatric Hospital here in Reading, and he called somebody up, somebody actually from the crisis care team, and told me that I was to go home and I'd get a phone call about half an hour after arriving home from crisis care. So I got home, the lady from crisis care phoned me. She spoke to me on the phone for about 40 minutes, asked me some questions about how I was feeling and what was going on, and she decided she wanted to see me the very next day at the psychiatric hospital. So understandably I was a little bit worried, because I felt perfectly good, perfectly fine. So to be called into a crisis care at a psychiatric hospital when you felt good was a little bit worrying. So I went to the crisis care, answered lots of questions. I was in there for about 2 hours, and they decided to refer me to a psychiatric doctor for a full psychiatric assessment. For those of you that don't know, when you have a psychiatric assessment, you have to be interviewed by 2 doctors. Those 2 doctors don't meet to discuss you until they've met you separately, so they can compare their thoughts. I saw my first doctor about a week after going to hospital for the first time. I spent about 45 minutes with him, I suppose, and he decided that I am suffering with a dissociative disorder. A dissociative disorder basically is where your brain, your mind is trying to mask bad memories, trying to cover them up. Or it can also be, if you're incredibly unhappy, a dissociative disorder can take the form of your mind is trying to disassociate yourself with what's going on around you, so that you can actually kind of stop being yourself and stop being unhappy and be happier. And of course, when he told me that was quite a big thing for me, because I felt perfectly fine, apart from the anxiety that I've had. But he did say that a dissociative disorder takes the form of kind of withdrawing you from the world and withdrawing you from people, making you sort of antisocial, making you incredibly introverted. And I know that I have been, for many years, gradually withdrawing from people and social situations. Social situations make me incredibly nervous, incredibly worried, to the point where I don't want to do them, and to the point where I've been avoiding social situations. I've been avoiding people. I've got friends, very good friends, who over the years have become less and less my good friends because I've been seeing them less and less because I've been pulling away from them. So yeah, that was a bit of a shock for me, feeling good and fine, and then being told you've got to go to the psychiatric hospital and be assessed, and then being told you're not just anxious, you've got a dissociative disorder. But part of the dissociative disorder is that you often don't know that you've got it or what effect it's having, because obviously your mind is trying to cover up problems and worry and stuff. And sometimes I feel very much like I'm not myself. I spend a great deal of time daydreaming, away somewhere, and again, that's all part of a dissociative disorder. If you spend your time daydreaming that you're somebody else or you're somewhere else, then your mind isn't focusing on you as a person and what's going on inside. I've also another part of the disorder is you kind of become slightly obsessed with things, which I know that is definitely a part of me. About 18 months ago, 2 years ago, I suddenly became obsessed with buying and listening to records, vinyl records. I bought myself a record player, amplifier, speakers, CD player, record shelves, and lots of records. I spent quite a large amount of money on records. For quite a while I was kind of buying these records obsessively. I was buying records that I didn't particularly want. I've bought records that I've never even opened. I've taken them out of the boxes and then put them on my shelves and not played them. Now I realise that buying those records and being very incredibly obsessed with I've got to have records and got to be a part of this kind of record collecting community, I now realise that that's part of the dissociative disorder. So yeah, it's all been a bit of a shock for me. I went to my GP with some very mild anxiety and I wanted to discuss some help, and I come away a couple of weeks later being under the care of a crisis care team. I should add, actually, I've now been discharged by crisis care. They don't need to see me. I come away under the care of crisis care. I've been interviewed now by 2 psychiatric doctors, and they've got together and compared their notes and what they think. But I do have a dissociative disorder with anxiety and with sort of obsessive-compulsive thoughts, feelings, actions, whatever you call it. I guess it's OCD, obsessive-compulsive disorders. It's all a bit strange because I feel fine, actually, most of the time. But you have this thing, and it's a worry to know that you have this. My brain is trying its best to kind of tune me out and take me into the whole kind of world of different characters and different personalities to try and cover up what's really going on. So basically, at the moment, that's all I really know, apart from the fact that I'm going to have counselling for the anxiety, which is fine. It's going to be a talking therapy. The anxiety isn't the biggest problem. I'm also going to have psychotherapy, it looks like, for my dissociative disorder, and that's probably going to take quite a long time. It's probably going to be quite in depth, and from the small amount of research that I've done on the internet, I think it's not going to be very pleasant, because my mind is working very hard to bury bad memories and things that have happened to me in the past. And to cure your dissociative disorder, the doctors are going to have to go into my brain and drill down, not literally, obviously, I'm talking metaphorically, but to drill down to the root cause of the problem. And if the root cause of the problem is bad memories and remembering bad stuff, then obviously that's not going to be very pleasant for me. Yeah, but all in all, you know, I don't feel too bad. I still feel a little confused about everything, because I'm not really sure what's going on during the day. Am I zoning out? Am I drifting away? Am I, you know? So yeah, that's basically my situation. I'm also, the doctors have put me onto antidepressants, anti-anxiety medication. It's called citalopram. I'm taking 20 milligrams. I've been taking that for about 3 weeks, and that's certainly improved my mood. When I first went to the psychiatric hospital, I got pretty down and pretty fed up, and you know, couldn't sleep, couldn't eat, couldn't think about anything. So the citalopram has balanced my moods, so I feel better than I did. So yeah, that's my situation. I've had a full psychological assessment. I have a dissociative disorder with anxiety, with some OCDs, and I'm just hoping now that I can get the date for the beginning of my treatment quite quickly, because obviously you need to, you know, if your brain is tuning you out from reality and sending you off to other places, obviously you need to get that fixed. So yeah, that's my basic situation. I should just add, actually, I know that nobody from the psychiatric hospital at Prospect Park in Reading will be watching this, but I should just add that everybody that I've met since I started going to hospital has been absolutely wonderful. There's a lot of headlines all the time in Britain about the National Health Service, and it's not very good, and it's underfunded, and it's understaffed, and all that stuff. But everybody, the crisis care people, the staff at the hospital, the doctors that have interviewed me, even my GP, they've all been wonderful. I couldn't possibly have asked for better people to look after my health. So, I mean, that makes a big difference, because I feel very confident that when you've got good people around you, that they are going to help me and they are going to fix me. Because obviously, you know, this is broken and it needs fixing. So yeah, that's just a quick summation of what's going on with me. I'm hoping what I'm going to do is make regular vlogs on what's happening with my situation. So if I've said anything in this video that has meant anything to you, or if you're going through any kind of mental health issues, anxiety, depression, anything, you know, put some comments below the video. Click like if you like the video, so that I know that I can, if it's popular, I can make some more. Please subscribe if you'd like to be informed of when I make another one of these videos, which will be shortly. And if you are suffering with mental health issues, I just want you all to know that, first of all, you're not weak because of mental health issues. People who are mentally ill tend to be stronger because you tend to try and cope with everything on your own, but you're not weak. You're not on your own either, you're not alone. There's a huge number of people who have mental health problems. So don't feel lonely and don't feel bad. But also, you know, if you are suffering with any kind of mental health problems, go and see your GP, because I spent many years when I was younger with severe anxiety and depression. I didn't see my doctor for a long time, and I know that problems that I have today are probably as a result of having these problems for so many years before I saw somebody about it. So if you're suffering with any mental health, go and see your GP. Don't feel embarrassed or ashamed about talking about mental health to your GP, because that's what they're there for. It's nothing to be embarrassed or ashamed about if you have a mental health issue. See your GP. Don't feel like you're alone, because there are lots of us out there who have these problems. Okay? And don't think that you're weak, okay, or anything like that. Okay, because you're not weak. You have a problem. You have a problem with your brain, and that needs to be sorted. It doesn't make you weak. It's not something you should be embarrassed or ashamed about. Okay, so if you have any mental health issues and you'd like to ask me any questions, I'm not an expert, you know. I've lived with mental health issues since I was at primary school, so I'm not an expert, and I can't diagnose anything for you. That's your doctor's job. But if you have any issues and would like to ask me anything, please leave a comment below. Or if you don't want other people to see what you're asking me, if you don't want other people to see what you're asking me, then just send me a message. But please, if you have any problems with your mental health, please, the worst thing that you can do is do nothing. Make the call to your doctor, get an appointment, get the ball rolling. You can't deal with mental health issues alone. So there you go. I thought I'd give you a summation. I hope this video wasn't too long or too boring. I hope to make some more. Depends if people want to see this kind of thing, so let me know if you do. And I hope that wherever you are in the world, you're fit and healthy. And if you're not fit and healthy, I hope you get well soon. So take care, everyone, and I'll see you again real soon. See ya.